Hi, and welcome back to our series on infection control. In this episode, we'll be discussing the highly infectious Canine Distemper virus. In this video, we will be discussing two topics. The first is designed for veterinary staff, looking at infection control and management of Canine Distemper virus within the clinic. The second half of the video is aimed to educate clients about Canine Distemper and how they can best support their animals during recovery. Let's jump right in and take a look at infection control procedures in the vet clinic. There are 5 key areas of controlling and managing infectious diseases, such as Canine Distemper virus in the clinic. Early detection, isolation, disinfection and sterilisation, personal protective equipment, and waste disposal. Early identification of potential positive cases is imperative to minimising the risk of transmission. It is important that nurses have a sound understanding of disease transmission and are able to recognise the key signs and symptoms associated with potential infectious diseases such as canine distemper. When clients call the clinic, it is vital that nurses are able to collect a brief history, their current signs and symptoms, and quickly triage the patient accordingly, considering differential diagnoses. If canine distemper or another infectious disease is suspected, they should arrange for the consult to begin outside the clinic to avoid potential transmission to other patients. If the clinical signs are consistent with distemper, the CDV quantitative real PCR test should be performed for confirmation of diagnosis. Potential canine distemper cases must be isolated whilst waiting for the result, in accordance with the clinic's guidelines for infectious control and management. The clinic building was designed to ensure the isolation ward was away from the main clinic traffic and patients, have restricted access and a separate ventilation system to filter infectious aerosols. The isolation ward should be stocked with any equipment and supplies needed to treat the patient, to avoid movement in and out of the room and avoid contamination of clinic equipment. Barrier nursing should be used for any potential cases of canine distemper virus. The minimum PPE requirements include a disposable gown, gloves, and boot covers. All PPE should be disposed of in the infectious waste after use. Because canine distemper virus is so highly infectious, it can be spread indirectly to other patients if disinfection and sterilisation procedures aren't followed. The virus is easily inactivated by most disinfectants, so an alcohol-based hand sanitizer is recommended if the hands are not visibly dirty. It also is important that the patient's environment and any areas of the clinic they may have been in are appropriately disinfected to avoid transmission to other patients. All waste associated with the treatment of canine distemper virus patients should be double-bagged and disposed of appropriately as infectious waste. The virus is shed in their body fluids including blood, urine, faeces, saliva, ocular fluids, and respiratory secretions. Canine distemper is a highly infectious disease transmitted through airborne exposure and bodily fluids. Prevention of canine distemper transmission requires a multifaceted approach to reduce patient susceptibility by ensuring that they are up to date with their vaccinations, prevent direct transmission by utilising isolation wards, and reducing the ability of the virus to survive in the environment through the use of disinfectants. The clinic protocol for prevention of CDV includes isolating the patient to reduce the risk of spreading the disease. The isolation ward is used to quarantine infectious patients and should have dedicated equipment that should never leave the room, and enough supplies so that they do not have to leave the room to grab more supplies. In the isolation ward, you may find various items such as scales, stethoscopes, clippers, thermometers, medication, fluid pumps, housing, bedding, and bowls. The gold standard is that bedding or towels be disposable, or they are to be bagged and disposed of. However, for many clinics, this can have a huge financial impact. In such cases, the bedding must be washed separately on a hot heat cycle greater than 60 degrees for at least 30 minutes. Sometimes this means putting it through on 2 cycles. Barrier nursing should be applied by providing the appropriate PPE, which will be stored outside the isolation room. The PPE should include hair cover, disposable gown, gloves, face mask, shoe covers, and a foot bath. The foot bath should be the correct dilution of bleach and should be changed daily. Minimising the number of times the door to isolation is opened and the total number of people that go in and out will help prevent any cross-contamination. One method of controlling this is by nominating designated staff to care for the patient. Disinfection protocols and procedures are required to avoid the risk of disease transmission due to contamination. To determine the correct disinfectant to use for canine distemper virus, it's important to consider the type of pathogen, if the virus is enveloped or not, and its method of transmission. Sodium hypochlorite, more commonly called bleach, is proven to be effective at inactivating CDV and hence is commonly used to disinfect the patient's environment. The concentration and contact time will also affect how effective it is against CDV. A dilution of 1 to 20 and a contact time of 10 minutes has been shown to be 99.99% effective at deactivating the distemper virus. It's important to read the data sheet and follow SWPs and ensure PPE, including gloves and eye protection, are worn when handling chemicals. The data sheet for bleach also recommends wearing a mask and only to be used in well-ventilated areas, as it's known to irritate mucous membranes, including the lungs. When disinfecting surfaces, begin by cleaning off any visible organic matter before spraying the area with a 1 to 20 bleach solution. Allow 10-minute contact time before washing the surface with ethanol or F10 to remove any residue. Ensure the surface is completely dry prior to patient exposure. Canine distemper virus is also quite sensitive to temperature and has been shown to be inactivated when held at 60 degrees for excess of 30 minutes. To conclude, a disinfection protocol will prevent the transmission of disease. For example, appropriate hand hygiene with disinfectants such as F10 scrub will eliminate any contamination. Household bleach is the preferred disinfectant in order to activate canine distemper. Well, it's now time to change the tone of today's episode and talk a bit more about canine distemper for clients and how they can best support their pet's recovery. Canine distemper virus, also known as CDV, is a highly infectious disease caused by canine morbillivirus. It primarily affects dogs, but it can also affect ferrets and some wildlife. CDV is an airborne virus that can spread either through direct contact with body fluids or infected animals, or indirectly through aerosol particles or contaminated objects. Clinical signs of canine distemper include diarrhea, vomiting, high fever, respiratory symptoms including coughing and nasal discharge, with severe cases presenting more significant clinical signs such as seizures and neurological concerns, including paralysis, head tilting, and difficulty walking and coordinating in a straight line. Canine distemper virus is considered multisystemic, as it affects a number of body systems as the virus circulates the bloodstream. It can affect a dog's brain, spinal cord, respiratory function, and even gastrointestinal system. Over time, CDV weakens the immune system and may cause secondary bacterial infections in the lungs or gastrointestinal tract. Unfortunately, progression of CDV can be fatal due to high risk of developing neurological complications. Permanent damage to the nervous system can decrease a dog's quality of life, resulting in euthanasia. Canine distemper can be diagnosed through a variety of diagnostic methods, including quantitative PCR, serology, imaging techniques, and haematological tests. Quantitative PCR is a molecular technique used to detect the genetic material of the distemper virus in samples such as nasal swabs and blood, providing a specific diagnosis of distemper. Serology involves testing blood serum for antibodies produced in response to the virus, indicating exposure or vaccination history. Imaging techniques such as X-rays, ultrasound, and MRI are employed to visualise internal structures and detect characteristic changes associated with distemper. Haematological tests analyse blood components, revealing changes which, whilst aren't as specific as a PCR, can raise suspicion for distemper whilst coupled with clinical science. These diagnostics play crucial roles in diagnosing and monitoring canine distemper, guiding veterinarians and veterinary nurses in providing appropriate treatment and management for affected dogs. Fortunately, there is a vaccine available for canine distemper virus. The C3 vaccine protects dogs against CDV, as well as canine parvovirus and canine hepatitis. A booster is required every 3 years to maintain protection. For puppies, they should get their vaccine at 6 to 8 weeks old, and then repeat a dose every 2 to 4 weeks for 6 weeks. One more dose either at 6 months or 12 months, depending on your vet's preference, and then they'll need to receive their booster every 3 years to ensure that they maintain their protection. Managing canine distemper in dogs involves several key steps. Firstly, it's crucial to isolate the infected dog to prevent the spread of the highly contagious virus to other animals. Veterinary medical care should be sought immediately to confirm the diagnosis and assess the severity of the disease. Symptomatic treatment is essential, addressing symptoms such as fever, respiratory issues, and gastrointestinal problems. Following a veterinary appointment, intravenous fluids may be necessary to prevent dehydration, and nutritional support may be required if the dog loses its appetite. Antibiotics may be prescribed to treat secondary bacterial infections, or anticonvulsants may be needed for dogs experiencing seizures. Throughout the illness, the infected dog should be isolated from all other dogs until it is no longer contagious, which may take several weeks. Providing a stress-free environment and supportive care can improve the dog's comfort and chances of recovery, although there is no specific antiviral treatment for canine distemper. There is still so much that researchers and vets don't know about canine distemper virus. While CDV has been detected in a number of species, including ferrets, skunks, and certain big cats, the full range of susceptible species is unclear. New strains of the virus can develop due to natural mutations. However, we're yet to understand the diversity of distemper and its implications for disease transmission, severity, and vaccine efficacy. While some dogs may recover from canine distemper, researchers have yet to understand the long-term consequences of the infection. Well, this has brought us to the end of today's episode. We hope that you've learned something new about canine distemper virus, and you're better educated about how to control and manage the disease either at home or in the clinic. Join us next week when we'll be delving into zoonotic diseases and how a single bat in China took away life as we knew it.